Meniscal surgery, repair or removal? If you are facing a meniscus tear, you may be asking, should I repair it or remove it? This is one of the questions that will define the rest of your knee's health. I'm Dr. Sean Liu, your friendly orthopedic surgeon. My goal is to help you understand the most crucial decision for your meniscus tear. When you have a large meniscus tear, you have two primary options: repair or removal, a procedure called meniscectomy. Repair stitches the tear back together, preserving the natural cushion of your knee. This is often the best choice for younger active patients as it protects against future arthritis. A removal takes out the damaged piece of the meniscus. This is a quicker procedure and can alleviate pain immediately, but it leaves the joint with less shock absorption. It can lead to long-term wear and tear. Your surgeon will consider the location and size of the tear, as well as your age and lifestyle, to determine which option is best for you. The choice you make will directly impact how your knee functions decades from now. Your knee's long-term health is worth protecting. Getting a clear diagnosis from a specialist can help you make the right choice between repairing and removing the meniscus. Don't gamble with your long-term knee health. Let's get you the answers you need to make the right choice for your future.